Hello, I'm Paul Peterson for Aging in LA. There is a wide variety of senior citizen services in the Southern California region to choose from. Many of these services are provided by private organizations, while others are provided by public service organizations and others by government agencies, such as the Los Angeles Department of Aging, the department that, with CityView, produces this program to inform seniors in Los Angeles of the many services available to them. Today we'll talk about the Los Angeles Department of Aging and its role in our community. Stay tuned for Aging in LA. The mission of the Los Angeles Department of Aging is to improve the quality of life, independence, health, and dignity of the city's older population by managing community-based senior programs that are comprehensive, coordinated, and accessible, and to advocate for the needs of older citizens. Today we'll give you a behind-the-scenes look at how the Department of Aging provides services to the city's 500,000 seniors. We'll show you the ways to access those services and, very importantly, how to get involved. We'll also take you on a tour of 3 of the department's multipurpose senior centers and talk to people who work there and seniors who are enjoying the services and activities. But first, let's welcome our guests today. My friend Laura Trejo, General Manager of the Los Angeles Department of Aging, Marco Perez, Deputy Director of the Department of Aging, and Brenda Vasquez from Partners in Care, a nonprofit organization that develops programs for seniors. Thanks to all of you for coming. Now, I have to give full disclosure. I am not only a friend of the department, I'm a client. Thank goodness I found you, Laura, because I had no idea what services were available when my 5 grand old ladies suddenly needed help.
Well, we appreciate that we were able to find you and that you found us.
Oh, wow.
Unfortunately, that is true for so many families in our community that we appreciate the opportunity to be able to come today and share with the citizens of Los Angeles the great opportunities at the Department of Aging.
You know, it's so, families are so nuclear these days that they think they kind of got to make it up themselves, that the first ever to deal with aging parents, and that's just not true.
It is not true, and we have 15 multi-purpose senior centers throughout the city of Los Angeles, all of them prepared to be able to provide support, information, services, and resources to our families. And so we encourage them to reach out to us. They can call us by using the city's 311 number.
Yeah, what a neat facility. 311, how simple is that?
Absolutely.
Gosh, it's really, and it's true that I didn't know you existed. I'm pretty familiar with city services. But that thicket that I was confronting, because people have heard me tell this before, that we were going from non-medical home care to Alzheimer's to issues of senior alcoholism, and it's like, holy smoke, there's a whole range. Do you find that true as when you try to counsel people and say, we have a lot of things to help you here?
Oh, absolutely. We have the Department of Aging, together with a lot of our contractors. We provide those services, we do the counseling, and we tailor each one of those services to each individual when we are out there.
Well, now, it's not just something that is well known like Meals on Wheels. There are other things that are available where a person or a family, for example, can have, well, an assessment, frankly, of their needs.
Absolutely.
And I think that's critical. Now, how many people are served beyond the community at large, the 500,000 I mentioned earlier? How many people on a regular basis is the Department of Aging helping?
Well, for example, just in our meals programs alone, we serve about 10,000 seniors daily. We provide almost 2,000 meals a year. We provide an array of social services within the community. Some of our seniors utilize more than one service at any one time.
Right.
We serve at any one time about 20,000 unique clients. Our information and support program where we get the call-ins, we may serve anywhere from 50 to 100,000 callers a year.
Wow.
So we really are there to serve you, and we welcome the opportunity to be of service.
Now, Brenda, I have not forgotten you, I promise. Tell me about Partners in Care. What is it? What does it do?
Well, Partners in Care has been around for about 85 years now. It originally started as the Visiting Nurses Association, but that when that agency was sold to a for-profit company in 1997, our founder, June Simmons, built basically from the ground up this organization that is called Partners in Care Foundation. And the dream and the vision of Partners is basically to find new ways to deliver health services and social services to families. A large part of our work is centered around aging well, and we have a number of evidence-based programs that are nationally recognized for having been tried and tested in a number of settings. My particular program that I'm responsible for, which is the Disease Prevention and Health Promotion Program, brings a number of services to the seniors at all 15 senior centers, the service areas, including the congregate meal sites, because we don't just go to the main centers. But we're using a collaborative model of care. We bring together universities, teaching hospitals, nursing programs, the pharmacy school at USC, the medical doctors at UCLA, and working with a number of agencies, we're able to bring teams of health providers to each of the senior centers in community-based settings where seniors are getting screened for chronic diseases, they're being taught how to manage their diseases, they're being taught how to prevent, because a lot of seniors are younger that are coming into the centers now, so we're going to have to start getting creative with how we're bringing these services.
Well, which means we have to have centers that appeal. Now, I promised our viewers earlier that we were going to visit 3 of the multipurpose senior centers that are strategically located throughout the city of Los Angeles. And first up, we're going to share this film, the Hollywood Multipurpose Center on St. Andrews Place in Hollywood. We met first with Wanda Jefferson, bless her heart. She found me wandering around. She's a nutrition director at the center.
Multipurpose Center, we have different services that we offer to our seniors here. Social services, adult day care, transportation, and of course, my department, nutrition.
Well, critically important because so many seniors are having difficulties caring for themselves, right?
Yes, and our nutrition program is 2 parts. We have the congregate meal sites, which are the pretty healthy seniors who can get out on their own, take the bus, and come here and have a healthy lunch every day. Then we also have the home delivered meals seniors who cannot get out of their apartment. They cannot cook for themselves, and they depend on us daily for that hot meal each day that gets them through the day because they cannot get out.
There are plenty of activities at the Hollywood Multipurpose Center. One that we really enjoyed visiting was a swing dancing class. Now that's music. Next, we stop by at the Adult Daycare Center.
This is the Adult Day Services Program. Our program is for people who are cognitively impaired or physically impaired. So they need some socialization, cognitive stimulation, interaction. They need to get out of their home, some supervision. The main idea for our daycare program is to keep the individual engaged in social activities and engaged in the community.
We all know the value of exercise, and at the center, seniors are encouraged to take part in a workout prior to the noon meal. Social interaction is an important part of senior living. We spoke with Jim Fanner, supervisor of case management at the Hollywood Center.
Social network, and you meet more people here. Even if you're older, you can still make more friends. You can still connect with people, and that's really helpful. That's the most successful way to age, is that if you've got a social network around you, if you've got a lot of friends and family, if you don't have family, build friends around you. That's what'll make it work.
And don't be afraid of change.
Exactly. It's hard for us Americans. We don't like change, but it's happening, and so come out, meet some new friends, and party.
Oh yeah, and we love the Department of Aging. They're very supportive in anything that we want to do here, and they try to work with us to get the things that we need for the seniors.
Yes, indeed. Everyone has a great time at the Hollywood Multipurpose Center. Now, if you live in that area, check it out. Laura, what a fun center that was to visit and to see the committed staff.
You know, we're very fortunate in Los Angeles. Our multipurpose centers really serve as focal points in our community for seniors and their families. We have very dedicated people who work there, highly trained individuals who are ready to provide that support and assistance.
Brenda, let's talk about staffing. I understand that today we're about 400,000 healthcare professionals short when it comes to taking care of seniors. There's a lot of education issues here that we need to address so that we have competent staff to deal with seniors. Are you working in that area as well?
We are, Peter, and what I'd like to share about is one of our programs, which is the Geriatric Social Work Education Consortium, which works to bring together agencies and universities and to be able to stipend second-year placements for Masters of Social Work students. Now that's coming to address a number of issues, but we're even taking it a step further. USC has now begun a program that will accept nursing students or just nurses that are already licensed who want to become social workers. Right. And if you understand, some of the programs that we have, for example, require in-home assessments for the MSSP programs that require a separate nurse and a separate social worker to do this kind of comprehensive assessment. Well, if we have nurses that are licensed social workers, we're going to be able to really maximize the resources in terms of staffing. We're doing all sorts of campaigns to recruit students to go into the nursing fields. You know, this is one of the greater crises that we are facing today in the country.
Fooling. Yes.
And in addition, with the baby boomers coming in to the senior center settings as we speak, they're just now becoming 60.
Yep, every 7 seconds another one turns 60, yep.
And we will have to address the challenges that come with this new population because it is a younger population, the demographics are different, and the demands and expectations, I think, will be different.
Right, and I think there's a key point. Their expectations of the healthcare delivery system are much higher.
Yes.
They're going to demand excellence and competency, but as we've heard from so many seniors, they still want somebody to care.
Right.
You've got to be not just credible, but seriously be concerned about the welfare of a senior population. We're going to take a little break here to go to East Los Angeles and visit the International Institute, another of Los Angeles Department of Aging multi-purpose centers. Every Wednesday, the Buenos Amigos Club sponsors Bingo.
Miren, yo salí de 86.
Oh, 63, 63.
The bingo we do, we play every Wednesday. And all the money that we gather, the leftover from the bingo, we put in the bank. We got a secretary, we got a treasurer, and we deposit it in the bank. And whenever there's a birthday coming up, we'll buy them a cake or do whatever they want. We ask them where they want to go. They want to go to the beach or any place they want to go. And we take them to the trip to the casino, the money that we have from the treasurer, we take it out and spend it on themselves for the trips that we do.
Is there a membership fee?
Well, the membership fee that we charge is $3 a year. They join the club to have fun. A lot of people that live by themselves, and they like to come over here and spend some time with them. You know, talk about whatever they want to talk about it, and thus they have a lot of good time around here. A lot of times they like to go home, they like to spend more hours in here because it's kind of hard to live by themselves. They don't have nobody to help, or that's why most of the people that come over.
I enjoy it because it has a lot of privilege for us, the old ladies, the old people. And I made a lot of friends, so I like it here.
It has a variety of a lot of services for the elderly. We have enjoyable trips. We have dancing. We have arts and crafts. And we have, we celebrate a lot. and we really have a lot of entertainment. besides all the services that our Department of Aging gives us.
We like it. We get out of the house. We get out of the house for a few hours and we enjoy it because we make friends over here. We talk, we gossip with everybody. So I like it.
Yes, we enjoy it because we celebrate every special event, every celebrate event that we have. I mean, bilingual all nations, including St. Patrick's Dance.
So now, if you're a resident of East Los Angeles, drop by the International Institute on South Boyle Avenue. Brenda, do you have a bingo story, or are you using bingo?
You know, we live in such a diverse city. It's such a wonderful city, and the diversity is amazing. We had one of the challenges for us to come in and bring health education and workshops to some of the centers is that people would not give up their bingo. And so we decided, how do we help people learn about their health and empower them to self-care, to provide self-care to themselves. And one of the interns came up with this idea of doing a health bingo. So they invented, partners probably will think of branding this some way so we can raise more money to do more programs, but now they play bingo and they're learning how to manage their diabetes through a fun game. And this is what I mean about the creativity that we need to all engage in.
It's incumbent on us because we're going to have to market this. There's a lot of there are a lot of things going on in everybody's life, and to get them important information is a challenge. Now, it's time for a short break, and when we return, we'll continue our behind-the-scenes look at our own City of Los Angeles Department of Aging. We'll be right back.
Need a recycling center? Call 311, the toll-free number for non-emergency services. 311, your one call to City Hall. Graffiti removal? Call 311, the toll-free number for non-emergency services. 311, your one call to City Hall.
The Department of Public Works Bureau of Contract Administration keeps the city's projects on track, ensuring safety first and fairness always, from the streets all the way to the stars.
Welcome back to Aging in LA. Our topic today, the City of Los Angeles Department of Aging, its facilities, and its services. Let's meet our guests once again. Laura Trejo, General Manager of the Los Angeles Department of Aging, Marco Perez, Deputy Director of the Department of Aging, and Brenda Vasquez from Partners in Care, a nonprofit organization that develops programs for seniors. You know, we were just talking about some of the many things people have to know about. For example, if your vision is failing, what are some of the aids available to people? Who are the experts in that field? If you're having housing issues, and that's what the department has as a clearinghouse, right, Laura?
Correct. And all of our multipurpose centers throughout the community have information and support staff available on site, in addition to any centralized services we offer. So I always encourage folks to start at the local community level. The centers have been designed to really serve as a focal point in the neighborhoods so that families and seniors can come and ask their questions and try to resolve and get a solution within the local provider network that exists there.
Well, I had a chance to look at the intake network, if you will. It's very user-friendly. You can come with your mom, for example, or someone you're caring for. And tell me about that procedure. Once needs are identified, a person can kind of walk out with, well, here's some numbers to call, right?
That is correct. One of the things we do, we also, Paul, just to share with you, we have a website, a couple of websites.
Oh, let's make sure we get those out.
Which definitely are great sites for caregivers, especially, that don't have the time to come to the centers and get the information. They can do it at their own time. And at that time, they can look through all the series of information and programs that we have available to them.
Okay, well, let's give at least the main website. And we'll put it down the screen after you tell us what it is.
The main website is www.cityoflosangeles.org/forward DOA.
Okay,
Yes.
very good. All right, we'll make sure that that's on the screen. When you watch this show, you have to have a pencil and paper. And now it's time to visit the third of our multipurpose centers, of which there are 16 throughout the city of Los Angeles. Let's travel to Wilmington and the Wilmington Jaycees Foundation, where they recently celebrated the move to a brand new facility next to Banning Park. Gary Kern is the director of the center.
We have a number of people that come from the surrounding areas, but the majority of the folks are right here, local people that come pretty much every day, participate in all the different programs that we have, and hopefully we keep them with us for a long time.
Well, I love the enthusiasm that so many of these people have, and it doesn't quite matter whether it's the Unity Club or the crafts or dance contest.
Right. Yeah, we actually have 4 different clubs that meet here, Monday, Tuesday, Wednesday, Thursday. I kind of keep track of them that way, and instead of trying to keep track of them by name.
Yes.
But and the majority of those members are different people. So it's not like one person comes 5 days a week. There's a good rollover of different seniors that come in and participate and, you know, take the things from here that can benefit them.
Group exercise is great not only for the workout benefits, but also for social interaction. We spoke to one of the participants during a break in her class.
Well, I retired. I developed diabetes, and then I developed also arthritis.
Well, because you were sitting around too much?
Sitting around too much. I can honestly now say that my arthritis has receded. I am now very mobile, and my diabetes is almost under control, and above all, the socialization.
As you can see, there's plenty of socialization in Wilmington. As a matter of fact, one of the seniors brought me into her own circle of friends. Walk over with me. I want you to introduce somebody to you who came over to talk to me because we kind of grew up together, didn't we?
Yes, we did. We really did. I used to watch him every day.
Well, see, it's an icebreaker, guys.
Older than him.
Maybe not. What do you get out of coming to a club like this?
We have a lot of fun.
Right?
We tease each other. We joke about each other. We hug every morning and we kiss when we come.
I imagine that for some of the people who walk through the door, that this meal that you serve is very important to them.
Yeah, I would say that probably half of the people that are here that come for the meal, this is their main meal. They have a little breakfast, they have a little dinner or supper, but this is the main meal that they survive on. And we're very fortunate in that we have our own central kitchen. So we prepare our own meals. We can keep a real good control over the quality of the food and things of that nature.
Arlene teaches an arts and crafts class in Wilmington.
When I started teaching here, the students were hesitant to speak English to me, and my Spanish was terrible. So I found that if they did something with their hands, they relaxed, and we both could communicate better.
Right.
And the crafts became the products of the class.
Well, and these are remarkably creative people. I want to particularly point out this wonderful bouquet. Can you tell me a bit about this, Arlene?
Well, these are spoon roses. They actually look like porcelain, but they're melted party spoons, and they're fused together over candles.
Now, isn't that fantastic? And now, of course, nothing goes to waste. If I can refer you, the bits and pieces of the spoons ends up being this wonderful little basket with flowers.
I would say our average age senior is probably 73, 74 years old. They've got kids that are in their upper 50s.
Right.
And, you know, we try to encourage as much as we can. For the ones that need to babysit, don't let that keep you at home. Bring those kids with you. We'll try to find something for them to do. We got a lovely area here outside. We've got the park next door.
Now, look, if you're in the Wilmington, San Pedro area, check out the Wilmington Jaycees Foundation Multipurpose Center, right on PCH and Eubank. It's really a nice facility, and Banning Park is right there. Now, Arlene mentioned something about the language barrier. Language, it really is no barrier at the department, is it?
It really isn't. Our multipurpose centers really are all very cognizant of the population they serve. And we all strive on a daily basis to recruit and hire staff that really are reflective of the citizens of the city of Los Angeles. So we welcome everyone. Sometimes, as Arlene said, we may have a little bit difficulty at the time, but I think our heart is always on the right place, trying to make our services and our programs accessible to everyone in the community, so they're all welcome.
Well, and I've had a chance to go around the city, and the sensitivity to cultural issues, more than language, that where people come from and the way their culture has developed, can help you better serve them. Isn't that correct?
That is absolutely right. One of the things we have done also, we have created the senior focus. This kind of a banding of all our documentation, all our documents to educate people about the programs that we have. They're done in English, Spanish, Korean, Japanese, and Chinese, and we're developing Armenian also. So we're conscious of all the different cultures that are within Los Angeles.
It has to be done. Now, Brenda, I mentioned to you that I favor these intergenerational programs where the seniors work with either at-risk youth or just youth in general, the kids who maybe haven't quite figured out that life is serious and you need some guidance. Are you working in that field as well?
Well, one of the things that we're doing, Paul, is trying to mix new technologies in with empowering individuals to care for their own conditions, especially chronic conditions. So what we've done is some of the senior centers already have labs in place, and we're able to come in with some of the graduate students to come in and tutor the seniors in the use of searching on the internet, finding health information, using some of the websites that allow them to input their own information and kind of coach them on a daily basis. So I think in that sense we are addressing some of these intergenerational issues.
Great. I'm sorry, but that's all the time we have for today's edition of Aging in L.A. Thank you all for coming in today. Laura Trejo, General Manager of the Los Angeles Department of Aging, Marco Perez, Deputy Director of the Department of Aging, and Brenda Vasquez from Partners in Care. The Los Angeles Department of Aging produces this program with CityView, Channel 35. So that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life. And also to let you know of the many services that the Department of Aging offers our senior citizens. Now, we'd like to hear from you with comments on the program, what you like, what you think can be improved, and ideas for future programs. Please give us a call. The number's right there on your screen, 213-252-4088. That's 213-252-4088. Call us with your comments and ideas. We look forward to hearing from you. I'm Paul Peterson for the Los Angeles Department of Aging, the people here at CityView, Channel 35, and all of our guests on Aging in LA. Thank you so much for watching, and we'll see you next time. Laura, thank you once again for coming. Marco.